The liver is popularly known for removing toxins from the body. This is just one of the approximately 500 functions of the liver. Some of its other functions include protein synthesis and the production of bile, which is necessary for digestion. It also plays a role in metabolism, regulation of glycogen storage, decomposition of red blood cells, as well as some hormonal functions. The liver is located in the upper right quadrant of the abdomen below the diaphragm. So this is the anterior view of the liver. This part represents the right lobe and this part represents the left lobe. This part in between the two lobes is called the falciform ligament, which indicates the point of division. The upper or the superior surface of the liver, as we can see, is rounded and fits right under the diaphragm. The lower or the inferior surface has a sharp edge, and this gives the liver a wedge shape. The front or the anterior aspect of the liver is one side of the wedge, and the posterior aspect of the wedge is the deep or the visceral side of the liver, which we shall look at soon. The coronary ligament of the liver is basically the parts of the peritoneal reflections that hold the liver to the inferior surface of the diaphragm. There are two triangular ligaments, one on either side of the coronary ligament, linking the ends of the superior border of the liver to the inferior layer of the diaphragm. The round ligament of the liver, which is properly known as ligamentum teres hepatis, is a degenerative string of tissue that exits in the free edge of the falciform ligament of the liver. One interesting fact to note is that the round ligament represents the remnant of the fetal umbilical vein. So, as the fetus is still in the uterus until 1 month or 2 after birth, the umbilical vein is patent. This means that it remains open. It subsequently degenerates into the fibrous tissue, which is the round ligament. Moreover, in adulthood, small para-umbilical veins remain in the substance of this round ligament. These veins act as important portocaval anastomoses in severe portal hypertension, which results in a caput medusae presentation. Now let's have a look at the posterior view. Anatomically, the round ligament divides the left part of the liver into medial and lateral sections. So we can see the impressions of the liver made by its contact with various other organs or the viscera. If we look at the center of this visceral surface, we can see the vessels approaching the interior of the liver through a space called the porta hepatis. Within this porta hepatis, we can see the hepatic artery, hepatic portal vein, and the bile duct. This part above right here is called the caudate lobe of the liver. It is located superior to the porta hepatis. Inferior to the porta hepatis, we can find the quadrant lobe of the liver. This is the inferior vena cava running a superior-inferior tract alongside the caudate lobe. The hepatic veins which drain the liver can be seen right here, merging with the inferior vena cava at the visceral surface just before it passes through the diaphragm and enters the right atrium of the heart. From the porta hepatis, the hepatic portal vein delivers poorly oxygenated blood rich with absorbed nutrients to the hepatic cells of the liver lobules. The hepatic artery supplies oxygenated blood to the hepatic cells or the hepatocytes. The bile duct drains bile from the canaliculi, also known as the little canals, among the cells of the liver lobules. These vessels and the microscopic lobules of which they are a part are the functional units of the liver, which represents the ultimate mechanism for distribution. This is one of the lobules we are talking about. It has been dissected so we can see the interior parts. At each corner of the lobule, we can see 3 vessels forming an interlobular triad. Each triad consists of a bile duct, a branch of the portal vein, and a branch of the hepatic artery. The artery supplies nutrient-filled blood to the liver cells. The vein delivers portal blood to the liver cells for the extraction of substances including toxins. The bile duct drains bile from the liver cells to be sent to the gallbladder. Sinusoids are located in between each triad and the central vein. The venous sinusoids receive portal blood to be sent to the liver cells to extract materials for processing. Interestingly, the lining cells of these sinusoids include phagocytic Kupffer cells, which serve as macrophages of the liver. These Kupffer cells take up microorganisms and undesirables from the circulation. The portal blood is drained from the sinusoids by the central vein. Now, the central veins are drained by the tributaries of the hepatic veins. Bile is drained into the larger ducts that are the tributaries of the common bile duct, which we saw at the porta hepatis. Within the collection of these three-dimensional lobules, the hepatic cells or the hepatocytes store and release proteins, carbohydrates, lipids, iron, and certain vitamins including vitamin A, vitamin D, vitamin E, and vitamin K. They also manufacture urea from amino acids and bile from pigments and salts. In addition, they detoxify many harmful ingested substances. Bile is released from the cells into tributaries of the bile ducts. So, like we said earlier on, the central veins are drained by the tributaries of the hepatic veins. These tributaries then merge to form three hepatic veins at the posterior superior aspect of the liver before opening into the inferior vena cava at the lower surface of the diaphragm. This diagram actually represents the simplified version of the portal hepatic system, which we shall consider in details in the next video. Thanks for watching. Remember to press the like button and subscribe to the channel. More videos coming up. See you in the next one.